We've created this short film so you can see what it'll be like when you have your operation at the Bristol Royal Infirmary. On the morning of your surgery, make sure you leave enough time to get to the hospital and find somewhere to park. You don't want a stressful journey. Remember not to eat anything after 2 AM, but you can continue to drink clear fluids such as water, squash, or any prescribed carbohydrate drinks up until 6 AM. We'd actually recommend trying to drink a large glass of water at 6 AM to ensure you keep yourself hydrated before your surgery. The pre-operative assessment nurses will have spoken to you about whether you need to stop any of your medications before surgery, but please remember to take all your other routine medication, as these are important. The hospital is air conditioned and it's important not to get cold whilst waiting for your operation, so bring warm clothes, a dressing gown and socks or slippers. On the day of your operation, you'll return to the department where you had your pre-operative assessment. Check in at reception and you'll be shown to a waiting room. From there, a member of nursing staff will take you to your bed space. Whoever is accompanying you can also wait with you. The nursing staff will check all your paperwork and may ask you some further questions. They may also take a repeat blood sample. They'll give you a gown and some TED stockings and ask you to get changed into them. You'll then see your surgeon and your anaesthetic doctor. The surgeon will talk to you about your operation. They'll answer any questions you have and ensure you've signed a consent form. Your anaesthetic doctor on the day may be different to the one you saw in pre-op assessment clinic, but they'll have all the information from your previous assessment. They'll review all the information taken in the pre-op clinic and confirm the type of anaesthetic and pain relief you'll have. You may also see a physiotherapist who will review your notes and will explain important exercises you can do to help recover after surgery. They'll ensure you're doing deep breathing exercise properly and teach you how to cough productively after your operation. You'll wait in the pre-operative assessment department until it's time for your surgery. You sometimes have to wait several hours until it's your turn for your operation, so bring something to keep yourself entertained. Your family member or friend accompanying you can stay with you during this wait. You'll be given a small amount of water every hour to ensure you remain hydrated before your surgery. When it's time for your operation, one of the porters will collect you from the pre-operative assessment department. They'll ask you to confirm your name and date of birth and will collect your notes. If you're able to walk, they'll escort you around to theatre. If it's easier for you, the porter can push you around to theatre on a trolley. Depending on which theatre you have your operation in, you may be anaesthetised in the anaesthetic room or in the operating theatre. First, you'll be asked to make yourself comfortable on one of the theatre beds. Your anaesthetic doctor, one of the anaesthetic assistants and a member of the surgical team will be present. There may be some other members of staff who are there to help look after you. They'll all conduct another safety check, where they will ask you to confirm your full name and date of birth and what operation you're expecting. Next, they will attach your routine monitoring, a blood pressure cuff, an ECG monitoring your heart trace and a probe on your finger measuring your oxygen saturations. The anaesthetic doctor will need to insert a cannula or a drip in the back of your hand so they can give you some fluids and medicines straight into your vein. Many of you will have had one of these before, but if you haven't, it will feel just like the sharp scratch you feel when you have bloods taken. Sometimes the anaesthetic doctor will insert a different type of drip called an arterial line. This will feel just like having a second cannula inserted. It's used to measure your blood pressure continuously during the anaesthetic and avoids us having to blow up the blood pressure cuff so frequently. To start the anaesthetic, you'll be given a strong painkiller. This starts working really quickly and will make you feel all nice and relaxed. Next, they will give you another medication to gently drift you off to sleep. The anaesthetist will monitor you throughout the whole operation and ensure that you have all the medicines you need. When the surgery is finished, the anaesthetic doctor will wake you up and take you to the recovery unit. In the recovery unit, there are specialist recovery nurses who will monitor you regularly and will ensure you are comfortable. It may take a little while to feel wide awake after having an anaesthetic. This is completely normal. Remember, as part of your surgery, it may have been necessary for the anaesthetic doctor or the surgeon to put in some extra lines whilst you were asleep. These will have been explained to you before the operation. For example, you may have a second cannula or a central line in your neck. You may have a urinary catheter in your bladder or a tube coming out of your nose which goes into your stomach. You may also have a line providing you pain relief. The recovery nurse will explain what everything is. Remember, it's really important that you're not in pain so that you're able to cough, deep breathe and do your lung exercises to prevent you from getting a chest infection after surgery. Our specialist recovery nurses will ensure you have enough pain medication so that you're comfortable. After surgery, we recommend that you do your lung exercises that you've been practicing every hour. Sometimes anaesthetic drugs can make you feel slightly nauseous when you wake up from surgery, even though we give you medicines whilst you're asleep to stop this. Luckily, there are other medications which the recovery nurses can give you to take this feeling away if you need it. When the recovery nurses are happy that you've recovered well from your surgery, you'll go back to one of the surgical wards. Some patients may go on to the high dependency or intensive care unit after surgery. For more information on what it's like to be on intensive care, please watch the Staying on Intensive Care film. After surgery, we follow the principles of an enhanced recovery programme. This aims to ensure you recover well from surgery, are discharged from hospital as early and as safely as possible with the best possible outcome. The enhanced recovery team consists of surgeons, nurses, anaesthetists, dietitians and physiotherapists. As part of the enhanced recovery process, we aim to ensure you're in minimum pain and that you're eating and drinking as soon as possible and you walk as early as possible after surgery to help speed up your recovery. It's during this period after surgery when doing all the exercises you practiced before your operation will make a real difference. As soon as your surgical team are happy you have recovered from your operation and that you have all the support you need at home, you'll be discharged from hospital. We hope you found this film helpful. If you have any further questions, please call us in the Pre-operative Assessment Department.